Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Please see the indication and usage statement and important safety information at the end of this video.
David had moderately advanced bird's eye chorioretinopathy at presentation. He had an epiretinal membrane, significant vitreous opacities, active vasculitis, and chorioretinopathy. His presentation was very classic and typical of bird's eye chorioretinopathy. He was initially treated with an immunosuppressive and oral steroids. He had an incomplete inflammatory control, and we supplemented with short-duration intravitreal corticosteroid implants and injections. He showed a great response to local therapy but developed ocular hypertension, which was managed topically with the help of a glaucoma specialist. He was subsequently treated with multiple systemic agents over the next several years, including various immunosuppressives and biologics. However, his inflammation remained only partially controlled with systemic therapy, and there was concern for progression and vision loss. In addition, he had a number of systemic side effects associated with immunosuppressive therapy, some of which required intervention. Despite his prior IOP issues with local corticosteroid therapy, we decided to try it again. After discussing this with his glaucoma specialist, we proceeded with YUTIQ injections in both eyes. The process was uneventful. At no point did he develop IOP-related adverse events, even though he had previously experienced ocular hypertension with local therapy. He has continued taking the same glaucoma drops that he was taking prior to the YUTIQ injections. His inflammation has been under much better control. We have not needed to supplement his injections with any additional oral or systemic therapy. His IOP has remained in a desirable range. He has not needed any local steroid drops or injections since the YUTIQ injection. Given his tumultuous course with systemic therapy and the improved inflammation control with local therapy, he would like to continue with local therapy. He will soon receive his second YUTIQ injections in each eye.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.